All right. Hello, everyone, and welcome to iVET360's Town Hall webinar on COVID-19. My name is Kyle, and I am one of the HR and training managers here at iVET360. And today we are joined by Jamie, who is one of the analytics managers here at iVET360. Before we begin, I want to give you a heads up that video platforms are still experiencing some difficulties. So if you happen to run into any technical issues, give us a heads up in the question section of the dashboard. Also, if you happen to have any questions during our presentation, feel free to use the same question section in the dashboard and we will do our best to answer. This town hall is being recorded and will be posted to our COVID-19 resource website. That website is covid19.ivet360.com. Let's dive in. All right, so today, Jamie will be discussing the payroll protection program and what to do now that funds are gone. I will be briefly reviewing how to best help upset clients. And believe it or not, and for a much welcome change of pace, we will be discussing what to do to prepare for after COVID-19. And then we'll go ahead and finish up with some Q&A with myself. Jamie, go ahead and take it away.
Awesome. Thank you, Kyle. Hi, everyone. Like Kyle said, my name is Jamie, and I'm an analytics manager at iVET360. And today we're going to chat a little bit about the Paycheck Protection Program, or PPP. Now, even if you've already received your funds, or you're not planning to apply at all, or you're somewhere in between, the items I'll cover today are still applicable to you now and outside of this time impacted by COVID-19. So, of course, before we jump into everything, we want to talk about the updates that have happened this week with PPP. As you know, the first round of funding was depleted in 2 weeks, so pretty quick. So on Tuesday, the Senate passed a $484 billion bill in additional COVID-19 relief funding to amend the CARES Act. Included in this was $310 billion for PPP replenishment. $60 billion of that has been set aside specifically for smaller lending institutions like credit unions and community banks. Approval in the House is anticipated to be as early as today. However, again, the burn rate is going to be much higher than the initial round of funding, so we're expecting funds to be allocated out before 2 weeks are up. So with the first round of PPP funding depleted, what does this mean for your practice? You probably fall into one of the 4 scenarios listed here. Now, say you've applied and you've been approved, but you haven't received your funds yet. Anticipate delays, especially if you went through a big lender, but you should still receive your funds. Most practices we're seeing receive funds now apply through smaller and local lending institutions. If you receive that approval but no funds, definitely reach out and confirm the timing of the deposit with your lender. In the meantime, continue to manage your costs as if you weren't to receive relief funding, as this sets you up for success by maintaining operational health during this time when revenue is down. Once you receive the funds, of course, you know that your 8-week time period for loan forgiveness kicks in, so your cost management strategy may change at that point. However, don't bank on your loan being forgiven in full, as details and interpretations for PPP and loan forgiveness continue to fluctuate daily. You'll also want to weigh maximizing loan forgiveness against what's best for your team and your practice. So the second category is you've applied, but you're waiting for approval. Depending on your lender, you may still be approved for the first round of funding, but due to the mass influx of applications, your reply may have just been delayed. If you've not heard back yet, for sure reach out to your lender for a status update. If they let you know that you didn't make it into the first round of funding, confirm with them that your application will be considered for the second round of PPP funding. And of course, our same recommendation continues along with the same first scenario. Continue to manage your costs as if you weren't to receive funds, with the understanding that if you do end up receiving them, your strategy may change with cost management. Now, if you're in the process of applying or waiting to apply for PPP, go ahead and complete your application, as the second round of funding should be approved soon. However, as the burn rate will be higher for this round, and because those who already applied for the first round of funding should be considered first, it's not guaranteed that later applications will be approved. So definitely the same as other scenarios, be mindful of your costs and decreases in revenue trends, and work off the assumption that you won't receive funding or that you may need to explore other relief funding opportunities. The last category is that you're not planning to apply at all. Your hospital may be set up well enough to weather this storm without relief funding. However, in the chance that circumstances change and PPP funding is available for later applications, we recommend familiarizing yourself with the application and requirements to apply along with the loan forgiveness stipulations. Because you're foregoing the funding and monitoring expenses and cash flow closely to maintain profitability during this time is a must. Also, looking to other sources of relief funding is recommended if you change your mind down the road. So what do you do while you wait for either approval, funds to apply, or for just this COVID-19 impact to pass? As a practice owner or manager, your priorities are, of course, to the health and safety of your team, your clients and patients, and then to the long-term viability of your practice. To be able to monitor the operational health, you'll need to know your numbers. And the two that we're going to focus on are your daily average revenue and your daily average break-even point. For daily average revenue, it's pretty self-explanatory in the name, but it's your average revenue per day over a specific time period. With the hospitals we work with, we discuss year over year and month over month changes, but during this time impacted by COVID-19, we've also been focused on weekly and daily revenue, as knowing those numbers allows you to adjust this rapidly changing environment more effectively, efficiently, and quickly. So of course, to be able to calculate your daily average revenue, we need to know where to get this information from. Now, if you're an iVET360 client or you've taken advantage of our free months of Pulse access, you can pull your daily revenue from your daily stats tab. This will also, of course, show you your daily transactions and average transaction charge. On the flip side, you can look at your practice management software for a report to show your daily revenue over a specific time period. Now, once you have that detail, add up your total revenue for the last 7 to 14 operational days and divide by the total number of operational days. Looking at the last 1 to 2 weeks gives you a pretty good indication of your current revenue situation and what you should expect in the coming week. So for example, say that we have $50,000 in revenue over the last 14 days. This of course equals a $3,571 daily average revenue, or dividing $50,000 in revenue by the 14 days that you were open. Once you know your daily average revenue, we of course need to determine our daily average break-even point, or basically what is your daily average expense so that we can compare it to revenue. Your break-even point is where your expenses match your revenue. Your bottom line is zero. You've not made a profit, but you've also not created a loss. Now, if you have your own way of calculating break-even, totally fine and run with that. We have a few steps here that we recommend to simplify the process for calculating break-even. So for this first step, grab your profit and loss statement, your P&L, and calculate your 2019 calendar year expenses in total. This is the baseline that we're going to jump off from in calculating estimated 2020 expenses. Now, if you have items like owner's draws or mortgage principal payments that may not show up on your P&L, you'll want to add those to your expense as well. When in doubt about these items, ask your accountant or your iVET360 analytics manager. So the second step is to estimate any cost savings you've already implemented this year or you plan to implement by the end of 2020. So these are any costs that you don't anticipate to pay this year that you had to pay in 2019. The third step is the opposite. Estimate any expenses you've added already this year or plan to add by the end of 2020 in excess of 2019. So any expenses you didn't have to pay for last year, but that you will have to pay for this year. The fourth step combines the first three. So we take our baseline 2019 expenses in step one, subtract out those cost savings, and then add back the new expense for this year. This is your annual break-even point estimate for 2020. This is the amount that you need to make in revenue to have your bottom line equal zero. If revenue is more than this, you've made a profit. If it's less, you've created a loss. Definitely helpful to know total 2020 expenses, but we want to get to daily detail, which is more helpful to manage costs day to day and to compare to your most recent revenue trends. So to do this, step 5, take the amount, the annual break-even estimate from step 4, and divide it by the total number of operational days in 2020 for your practice. This is your daily break-even point estimate, or your daily expected average expenses for 2020. So for example, say that we have $1.5 million in expenses on your P&L in 2019, along with owner's draws and principal payments. So say in step 2, we renegotiated some service contracts or switched a vendor, resulting in cost savings of about $16.7K per month. So in total for the year, you have cost savings of $200,000. You're going to pay that less than what you had to pay in 2019. So for step 3, say you made wage increases in January or your rent increased. So that $15,000 is going to be extra expense in 2020 that you didn't pay in 2019. So of course, with step 4, we want to combine the 3. We take our baseline $1.5 million in expenses, subtract our cost savings of $200,000, and then add back the new expenses of $15,000. That equals $1.3 million in estimated annual cost for 2020. So of course, we want to get to daily. So in this example, we're assuming 288 operating days in the 366 days of 2020. So dividing the 1.3 million by the 288 gives you a daily average break-even point of 4,465. So these are your anticipated daily average 2020 expenses. So now that we've calculated the two numbers, what do we do with them? We need to compare them, evaluate them, and adjust them on a regular basis as new expenses or cost savings come to light and as your revenue trend changes over time. So in the examples we worked through previously, your daily average revenue was $3,571. Our daily average break-even point or anticipated daily expenses are at $4,465. So unfortunately, we're operating at a daily average loss of $894. And we get this by subtracting your break-even point from your daily average revenue. So of course, we're not maintaining break-even and not making a profit. And so there's two ways to be able to mitigate this. If possible, and definitely tough at this time, is to increase your daily average revenue to your break-even point of $4,465. On the flip side, you can adjust expenses down to achieve a daily average break-even point of $3,571. Now, you'll definitely want to adjust these maybe on a monthly or quarterly basis as you go forward, because as new data comes to light, your break-even point will change. And that's the number you want to keep in mind as you make business decisions now and in the future. It can help you decide if you want to add another staff member or if there's another cost you want to add to the practice if you're consistently operating above break-even point. But it can also give you quick feedback on whether or not your revenue is trending down over time and might drop below your break-even point, creating a loss for the year. So of course, no matter which scenario, one of the four that you may fall into with PPP, reviewing and managing your costs is key to long-term viability for your practice, even outside of this COVID-19 impact. We definitely recommend keeping your daily average revenue and break-even point in mind, month to month and quarter to quarter. And to help you with this, iVET360 is offering a few items at no charge. The first one is a cost of goods and labor tracking tool at this link here and housed on our COVID-19 website. There's a nifty little video that also comes along with it that will explain to you how to use these tools. These are typically a hospital's biggest expense categories, so being able to mitigate and control these expenses will help to bring down your daily break-even point. We're also offering 3 free months of Pulse dashboard access. This is your operational data. It'll show you things like new clients, revenue, transactions, and average transaction charge. But of course, it also holds that daily stats tab I mentioned earlier when we were calculating daily average revenue. The other item is a town hall with our analytics manager, Lindsay Rudder, next week. She'll dive a bit more into revenue and expenses and help you figure out how to best set yourself up for success as we come out of the COVID-19 impact. And of course, everything I've chatted about here is referenced in its own article on our COVID-19 website as well. And now I'll pass you back to Kyle.
Thank you, Jamie, for all of that PPP information. Now, I wanted to touch base on upset clients and how to best address them. Since our last town hall where we took a deep dive into client interactions, we have seen a gradual increase in the amount of questions we are receiving regarding upset clients. It is important to remember that COVID has affected us all in some way, shape, or form. And due to this, how we convey information to clients may need to be adjusted. Let's take a look at some of the tools we discussed on our last town hall. So client complaints are likely nothing new to your team. They come with the territory. However, it is imperative that we have extra patience with upset clients during these times. As best you can, we want to try and accommodate them without breaking any rules or obviously going against established protocols in place. To help ensure your team is equipped to handle these conversations, we recommend empowering the team to make the best decision for the client. As best you can, go above and beyond, within reason, but go above and beyond for your clients right now. Help your team understand angry client psychology. Just as we are going through some client behaviors today, do the same for your team. And then also give them some tools of their own to utilize. I can't tell you enough how much as a practice manager I loved using this first one. Thank the client for their feedback. When you thank a client, it is one of the most effective ways to disarm the conversation. It's really hard to be upset with somebody when it's more of a collaborative environment versus an adversarial. So thank them. Thank them for bringing these concerns to your attention. Thank them for allowing you the opportunity to improve your own team. Now, one thing you're going to hear me harp on a lot is saying yes if at all possible, but everyone knows sometimes the answer just needs to be no. However, if you do need to say no, it is imperative that you give them a reason why so they can at least understand why we need to pivot to another route to help them. So use the word because. And then if at all possible, find a way to say yes, even if it's yes, but, hey, I need to get in at 8 a.m., but that 8 a.m. slot is blocked. Yes, we can help you out, but it needs to be at 11 o'clock. That's as soon as we can get you in. Regardless of the tools you choose to utilize, it's important to remember just how far reaching this pandemic is. Most clients have been affected financially, so don't be surprised if you see more pushback on pricing. And this is one thing, again, why I've been harping on saying yes if possible. Most of your clients have already been told no multiple times before they called your hospital, whether that's within their own personal lives, going out to the grocery store, just trying to live a normal life. They've already been told multiple times. Try to be the yes they're looking for in their day. One other resource you can utilize would be learningvet.com. And right now, if you send an email to hello@learningvet.com, you'll get a free 3-day trial. On LearningVet, we have a wonderful course called Managing Angry Clients that will be super helpful for your team to be able to truly understand not only client psychology, but how to best counter certain behaviors that we see pop up more often. Again, that email is hello@learningvet.com. All right, so you heard me correctly at the beginning of the show. We are going to be discussing the after portion. And it can be understandable in all this hustle to try and manage day-to-day changes due to COVID-19 that maybe some of your down the road or even your administrative items have been put on pause. Also, we would like to make sure you guys understand that there may be a lag time between when restrictions are lifted and when clients begin returning to your facility as normal. If this is the case, we have come up with some ideas to keep your staff busy. Let's take a look. So first, revisit your most recent performance reviews. Identify any personnel that might need remedial training. Is there anybody who really needs to work on their phone skills or really needs to work on pet restraint or maybe learning how to set that catheter? As best you can, isolate those personnel first before we move on to any other personnel. And also identify any staff that have already mentioned, hey, I want to step up to the next level. I want to be a leader, and see if they can help with training. And the one big piece that I want to go over today is cross-training. So to cross-train or not to cross-train, that really is the question. The answer is yes. We definitely want to be cross-training, but we want to ensure that we have an effective process in place. I know in my experience, I've seen different styles of this, and by and large, it really can be tempting to throw someone with less experience to your most experienced employee, but that doesn't always pan out to be a successful way to cross-train someone. So if you are going to cross-train, we're going to go through each one of these bullet points and kind of dive in how to best structure it. So first, gathering all of your training documents. Then consolidating how you do each task within a position. Then we'll select your trainers appropriately, and then utilize a frequent follow-up schedule. So first and foremost, documentation. As best you can, try and cluster topics. Instead of saying, hey, Kyle, go to the front desk, learn how to be a receptionist, try and break it down day by day. On Monday, we're going to focus on how to open the hospital. On Tuesday, we're going to focus on how to close. That way, they'll have a better chance of retaining those skills and being able to remember them if things happen to hit the fan and it's stressful at the wherever new area they're at. Also, ensure your employee understands how they will be judged on their success. If your employee does not completely understand how to successfully complete a new concept, they will make mistakes down the road. Ensure also they understand that this isn't just going to be a fill-in position. I think that's where a lot of cross-training can fall short, is that we don't enforce the fact that you may be put in this position for long-term, not just to cover a lunch or to cover someone who happens to be out for a day. You need to feel confident as though if I put you in a position tomorrow, there's no indefinite time that you'll be going back to your normal position. Establish a timeline. Again, just because someone has already been within your facility and may already understand many concepts of how to do the job that they're being trained to do now, you want to ensure that you hold them to a standard so that you're able to push that training forward and it's not just a lingering, well, we're kind of training, it's in limbo and we're back and forth. Set timelines, set deadlines, and make sure we have a confirmed endpoint for training. Then also signatures. Down the road, if there are any training deficiencies, you want to be able to track down who specifically trained what in case you need to either give remedial training to that new employee or someone who is cross-trained, or on the other end, go back to the trainer and say, hey, why did we teach it this way? And be able to seek to understand. Consolidate how you do each task. In this industry, there can be dozens of ways to complete a single task. And while that's not always problematic, this style of teaching creates an opportunity to learn bad shortcuts. We've all heard it. We're supposed to do it this way, but here's how I do it. And sometimes that's not an issue as long as it falls within protocol, but we don't want to be teaching bad behaviors. And this, for me, is probably one of the more fun portions, and that's picking who gets to train the staff. Who's building up that new employee, or who's building up, that long-term VA that now needs to be schooled up on how to be a receptionist. But before you select your trainer, I want you to ask yourself a couple questions and come to the reality that just because someone is really good at their job doesn't necessarily mean that they're really good at training or being able to give that information back to someone else. So has this person shown that they can consistently be counted on to do the right thing? If you're not in the hospital, can you trust that, hey, I know that Kyle is going to be able to push that person who's cross-training through their process and that he's going to keep them on target? Has this person had any formal training or direction on how to train? Again, go with this new trainer and say, hey, how do you plan on training this? Here are our training materials. How are you planning on going through it? And make sure that you are both aligned on how specifically you want that employee to be trained. And arguably, one of the most important pieces is, can you count on this person to give you accurate feedback? For me as a practice manager, one of my biggest pet peeves was wasted time. And you need to be able to count on your trainer to give you accurate feedback and have the courage to come to you and potentially say, hey, we need more time to train this person because of these reasons. And that way, you don't put this person in role to find out 3 months later that there's actually a big gap in training. And then the last portion is utilizing a frequent follow-up schedule. Everyone really wants to organize their training schedules as crawl, walk, run. And on a normal day, that usually is able to be achieved. However, what we really want to focus on is when things start to hit the fan, when emergencies start walking in, when someone calls out. Does your plan go from crawl, walk, run to crawling, and now we're sprinting? And I know sometimes you don't really have a choice. You do need to be able to put people in positions where you can keep the hospital running, and that's understandable. And if that's the case, you need to do your best to be there to answer any questions they may have. I've been in role many times where, before I really got experience in this field, where I felt like, shoot, I just wish I had someone here to give me that extra piece of information I'm missing. And it'll also help them with not feeling so intimidated the next time they need to step in role. All right, so now we have ensured everyone who needs remedial training has been addressed, and maybe we have some hybrid role all-stars. So now what? Sure, we could jump directly back to that training or the cleaning list. And that's understandable, and we definitely want to ramp up our cleaning in light of COVID-19. But we've also come up with some other ideas that you might be able to implement instead of just your general let's go deep clean. Consider cleaning the air vents. Out of sight, out of mind. When was the last time your staff looked up to see if there was any dust or debris pooling up around your air filters? Pressure wash your sidewalks. Your clients are going to appreciate a fresh new look when the world finally opens back up. Capitalize on all of these new pet owners. I'm sure we've all seen the social media posts and the news posts about shelters being emptied from everyone fostering, which is amazing. But I think we can utilize that and target these new pet owners with new puppy or kitten or even new pet owner packets. Conduct a full inventory. And I don't mean we're just checking our normal inventory from week to week. I mean pulling things off of shelves, checking expiration dates, looking behind that one locker that hasn't been moved in years, seeing what fell behind there. Look and see what's in your facility and see if you need to replace or better manage different aspects. And I threw this one on there in the bottom right. I know some of you are shading your eyes and you're looking away, but it's the truth. If you can, double check your OSHA logs. Right now, if you have the time, you will thank yourself later for being able to take care of some of these administrative items that might have been put on the back burner. And now, I know you were all waiting for it, so we're going to jump in some question and answers. I know that we have Laura who's been answering some of the questions in the chat right now, and I have a couple questions that have popped up frequently that I want to go over. Some of them may seem repeated, but as COVID has evolved, so have some of the HR protocols and even statewide protocols on how we address certain issues. Question 1 from a hospital in Maryland. What do I do if an employee has tested positive for COVID-19? First, you want to ensure you inform both staff and clients who interacted with this employee that they may have been exposed. Conduct a thorough deep cleaning of your facility. Encourage those staff members who have been exposed to closely monitor their symptoms. And this is the one big piece I cannot stress enough. Contact your local health department for any further guidance. States are differing on how they're receiving and dealing with different COVID cases, and I'm sure we're all seeing different parts of the country even opening up right now. So you may not be held to the same standard as this hospital in Maryland is if you live in California. So make sure you reach out to them so if they need to do any extra testing or if they need to do any other certification to say you're good to go, that you check those with your local health department. Question 2 from a hospital in South Carolina. Once the school year is over, does that mean my employees can't use EFMLA anymore, or the Expanded Family Medical Leave Act? EFMLA is not limited to the school year. So if an employee is experiencing childcare issues due to COVID-19, they are covered. Question 3, hospital in Arizona. Does my 8-week period for PPP or the Payroll Protection Program start on approval date or funded date? Good question. Your 8-week period for PPP will begin on the funded date, not the approval date, so the day you receive those funds. And that is it for our webinar. Thank you for attending. Our next town hall will be Thursday, April 30th, where we will be hosting a special webinar that will focus solely on how to get your hospital back on track after the COVID-19 restrictions are lifted. We will have our marketing department discussing how to re-engage clients, our analytics department discussing managing finances, and our HR and training department discussing helping teams reintegrate and keeping them busy. We will send you an email with the link to sign up for this special event. Also, as always, ensure you stay tuned to our COVID-19 resource website, covid19.ivet360.com. Then also visit the website below for any additional HR support regarding COVID-19, iVET360.com/HR. Thank you, everyone.